Commonly, after I've applied a cast, for example, on an arm or a leg, I'll take the parents through compartment syndrome, especially if I'm sending them home, so they can just look out for those particular symptoms that are worrisome and to bring the child as soon as possible. So compartment syndrome is relatively rare. However, it's one of those conditions that's almost unforgiving, that when it happens, it can lead to the loss of a limb. So today we'll be talking about what compartment syndrome is and how to diagnose it. Hi everyone, welcome back to Little Growing Bones. So today we'll be talking about an important but often misunderstood topic, and this is compartment syndrome in children. So if you're a parent or a caregiver, knowing the signs and what to do when you suspect compartment syndrome is very important. So let's like, kids are naturally very active, and sometimes accidents do happen, like a bad fall, a broken bone, or even sports injuries. So while many injuries heal with time, some can lead to a serious complication, which is compartment syndrome. So what exactly is compartment syndrome? So just for a minute, imagine your muscles are like sausages packed inside a tight compartment, surrounded by a tough layer of tissue that we call fascia. So normally there is just the right amount of pressure in these compartments. But if there is swelling or bleeding, the pressure can build up immensely, up to such dangerous levels. So this can block the blood flow and damage the nerves and muscles. Compartment syndrome can happen anywhere, but it's most common in the arms and the legs. It's a medical emergency. I can't emphasize this enough. It's a medical emergency. So recognizing it early is critical. So what are the causes of compartment syndrome? In children, compartment syndrome often follows a traumatic injury like a broken bone, a bad bruise, or even after surgery. So sometimes it can develop after something as simple as wearing a cast that is too tight. Remember, children may not always communicate their pain clearly, so it's up to us to watch for the signs. So this takes us into the signs and symptoms of compartment syndrome. So here's what to look out for. So the hallmark signs of compartment syndrome are often called the 5 Ps. So there's pain, pallor, pulselessness, paresthesia, and paralysis. I'll describe this further. So the pain, there is severe pain that doesn't go away even when the medication for pain is given. Pallor, the skin looks a little bit pale or shiny. The other is pulselessness, so a weakened or absent pulse in the affected limb is another sign, but this is the left sign. Then there is paresthesia, so this refers to tingling and numbness felt around the affected limb, and paralysis. So they could have difficulty moving that affected limb. This is what's most commonly studied in the literature when you look at the signs and symptoms of compartment syndrome. It could be different for children. So in children, we look out for the 3 A's. So these include agitation, anxiety, and an increased need for analgesia. So we don't wait for things like pulselessness and pallor and paresthesias because these are late. In fact, if the child is complaining about pain and you're giving the painkillers on time, but they don't seem to be responding to them, they're continuously crying, then that should make you think that, oh, it's probably compartment syndrome. So if your child has any of these symptoms after an injury, it is time to seek medical care immediately. All right. So how do we diagnose compartment syndrome? After an assessment where we have examined for the previously mentioned 5 Ps or the 3 A's that I previously mentioned, there's something that can be done when compartment syndrome is suspected. One is that we'll feel for how tense the limb is. We'll gently move the nearest joint and see if the pain is increased so much when this is done. This is called pain on passive range of motion. Another thing that can be done is measuring the pressures within those compartments. So there are documented pressures that are expected to be present in certain compartments, and therefore if they're higher than what they should be, then it's probably compartment syndrome. So how do we treat compartment syndrome? As always, prevention is better than cure. So once it's been suspected, any tight dressings or casts around the affected leg, for example, have to be released to give that area space to swell. Another thing is trying to elevate the affected extremity to try and improve and decompress that area. The surgical treatment for compartment syndrome is called the fasciotomy. In a fasciotomy, the doctor makes a cut in the fascia to relieve the pressures inside the compartment. So this is a life-saving procedure. A fasciotomy is a limb-saving procedure, and it prevents permanent damage to the limb and the muscles. Now let's talk about prevention and aftercare for compartment syndrome. So while you can't always prevent compartment syndrome, there are steps that you can take to reduce the risks. So one is to make sure the casts are intertight, that the bandages are intertight. We need to keep an eye out on injuries for unusual swelling and uncontrollable pain. So after treatment, physical therapy can be helpful in helping the child regain full strength and mobility of that affected area. So with the proper care, most children recover fully. So that's all we have today about compartment syndrome. If you have any questions, just leave them down in the comments below. And as always, keep it on little grandbuns.